Assalamu alaikum, my name is Aisha and today I am going to tell you about Disprosody disorder. And this is also known as foreign accent syndrome. It is a rare speech disorder that causes a sudden change in speech pattern. An individual suffering from this disorder may develop an immediate change in speech that is perceived as foreign accent, which is usually totally different from their native accent. Foreign accent syndrome cases have been recorded around the world. These accent changes from Japanese to Korean, American to British, British to Russian. New speech pattern accompanied by the foreign accent syndrome does not sound disordered and remains highly intelligible. Several subtypes of the disorder were identified in 2010: neurogenic foreign accent disorder and developmental foreign accent disorder. Neurogenic foreign accent disorder is used to describe an occurrence of the disorder after a damage to brain. It is associated with the psychiatric disorder. Developmental foreign accent disorder describes a situation where the accent is discerned as from early age. Next, coming towards the causes of this disorder. Disorder can occur brain damage or injury that impairs the control of muscles that produces rhythm and melody of speech. The accurate control of speech articulators like lips, tongue, teeth, jaw, and the voice box are required during speech. If the placement of the articulators is out of line, sounds made speech will be altered, including rhythm and tone. Stroke, which is the main cause of this disorder. Head trauma such as sharp blow to the skull, brain tumor, multiple sclerosis, brain hemorrhage, and developmental problems. People with foreign accent syndrome may speak in a rhythm and tone, such as changing sound quality by moving jaws or tongue differently during speech, making longer and lower vowel sounds like change in word ya to ja. Symptoms can last for months, years, or even become permanent. Diagnosis of Disprosody disorder. Since it is a rare disorder, so a team of medical professionals will be needed to evaluate, diagnose, and treat a suspected case of foreign accent disorder. They may include psychologist and speech language pathologist or neurologist. You may need to answer questions about your symptoms and medical history. A physical examination will be carried out, paying more attention to the muscles used in the speech. A recording may be used to analyze speech pattern. Images of your brain will be taken to see if there is any damage in the area that controls speech. These images are taken by MRI, CT, or SPECT scans. And electrical activity of brain may also be measured using an electroencephalogram. It can also be performed to check disturbances at the electrophysiological level. Next, coming towards the treatment of this disorder. Treatment option may include speech therapy and counseling. Speech therapy aim is to teaching you how to move your jaws during speech. Counseling can help you to learn how to cope better with the condition.
I often get asked, where are you from? Because of my accent. I had a stroke 20 years ago and now I have a different accent because of the stroke. When I woke up from the stroke, I didn't recognize my children or my husband. It was devastating. I started swearing, which I never did before, and I was doing very inappropriate things. To get my memory back, my friends would often show me photographs of people and of Alexander and Portia, my children particularly. It took a long time for me to realize who they were. when you've had a stroke, you realize the only person that is going to get you through it is you. You're the only one. I still have a bit of the accent, nothing like what it used to be, but I live in hope, and I am hopeful for everything.